news. That's why EWN is bringing the news to your smartphone, tablet, or PC. With EWN.
admissions now. This, unfortunately, is not happening in a country like the DRC, who had announced a lockdown, Bongani, but then after there's been a huge increase in the price of basic goods, they then postponed the lockdown. So we see, for instance, the DRC, they have about 58 confirmed cases. They're not going to do that lockdown, which of course creates all sorts of issues. Today, Zimbabwe starts their 21-day lockdown. And we also see in West Africa, Doctors Without Borders saying the situation in Burkina Faso, Senegal and Cameroon is of concern because of the jump in numbers. For instance, in Cameroon, there's been a huge jump in the capital, Yaoundé. We then see, moving to East Africa, the Kenyan police coming under fire for harsh action. There's a curfew in place, and the Kenyan police renowned for, really just going out and doing inhumane things, showing that they again will do whatever they need to do. Sad news, though, of this 20-odd-year-old South African woman in Kenya who committed suicide over poor conditions of quarantine. She had requested self-quarantine at a local hotel, and she then committed suicide. So this was big news in Kenya. And then meanwhile, on the economic front, Bongani, we see the African Development Bank raising $3 billion in a 3-year bond to help alleviate the economic and social impact of COVID-19 on livelihoods. And this is the largest ever social bond. We do see countries without corona remains Botswana, even though they're doing a lot of testing. Malawi is also without corona, but they've also imposed some strict lockdown rules. And then in West Africa, Sierra Leone, we also know still doesn't have any reported cases for now, Bongani.
I mean, the situations we find in places like Khayelitsha in this country are really a microcosm of what's happening on the rest of the continent. Mali, though, continuing to proceed with their election despite this outbreak.
Yes, Bongani, that's quite ironic. Not only do they have a COVID outbreak, but they also have this insurgency, which has really caused some havoc in the central and northern regions. So they held a long delayed parliamentary election yesterday because they say it has been scheduled since 2018 and has been postponed twice. So they had to go ahead with it because they need some sort of parliament to continue with the business, as they say, deal with the COVID-19 response. Unfortunately, one of the main opposition leaders, he was campaigning mid last week in Timbuktu, and he was actually kidnapped with 6 other people. He's not been heard ever since. And so despite all of these things happening, Bongani, the country went ahead with the election. In some cases, voters stayed away because they were simply too scared because of the insurgency and the corona. Other people came out to vote because they say they're desperately in need for a new parliament to deal with the coronavirus and the insurgency. Now, what we see, 147 lawmakers need to be elected for a full National Assembly. If that's not the case, a second round is supposed to be happening and is scheduled for April 19th.
Yeah, I mean, it's talk about a perfect storm. We think we've got problems, right? An insurgency and COVID-19. Crystal Alderson with this morning's Africa Report.
Put some distance between you and boredom during social distancing.
Click socialdistance.co.za.
COVID-19 is one of the biggest challenges the world has ever faced. Some people are reacting with panic and fear, buying more than they need. Some have shown amazing kindness and compassion. In these uncertain times, Liberty is in it with you. So speak to a Liberty financial advisor or your broker about any of your concerns. To help you make good, calm financial decisions, search Liberty Group SA. Liberty is an insurer and authorized FSP. T's and C's, risks and limitations apply.
Have you heard about the coronavirus 2019? A new respiratory illness that spreads from one person to another through droplets when an infected person coughs or sneezes.
This sounds serious. How do I protect myself and my community from getting and spreading this illness?
It's easy. Don't panic. Wash your hands frequently with water and soap for at least 20 seconds. Stay home if you're sick, or call coronavirus hotline to get medical advice.
Well, what about close contact with the sick people?
Just avoid it and do more by covering your mouth and nose when coughing and sneezing with an elbow or tissue. Clean and sterilize frequently touched objects and surfaces with bleach and other non-toxic chemicals.
Thank you. Now I can play my part to prevent the spread of coronavirus in my community.
For more information, please call Coronavirus Hotline on 0800 029 999 or send the word hi to the WhatsApp number 060 012 3456. Brought to you by the Department of Health.
Hey, so does your bank help with
life cover? Yeah, it's with FNB.
Because who knows your monthly expenses better than your bank?
Right? So who better to help cover the first few months' expenses if something happens to me?
On top of your life cover?
Paid out in 24 hours.
Very nice.
Does your bank help you manage your money like that? FNB does, with life insurance. Switch to FNB. How can we help you? FNB is a division of First Rand Bank Limited, an authorized FSP and credit provider, insured by First Rand Life. T's, C's and rules apply.
Follow 702 on Twitter at Radio 702.
Time for latest eyewitness news, after which we're going to be having a conversation about the state of our readiness to deal with the onslaught of patients. Ventilators is a big issue we've seen in places like New York. How many do we need? How many do we have? Some tough choices are ahead of us. I understand a normal ICU patient may use these things for about 5 days, but corona victims can need them for up to 21 days. Who gets, who doesn't? That's an important conversation coming up after this eyewitness news report brought to you by Clicks Pharmacy. Protect yourself and boost your immunity with the 2020 flu vaccine. Now available at 400 Clicks pharmacies nationwide.
This is Eyewitness News.
The president explains why you need to lock down, and Zandspruit residents say the fight was over before it even began. Good morning, I'm Tara Penny. President Cyril Ramaphosa has used his weekly newsletter to stress the importance of a national lockdown at a time when COVID-19 is devastating the world. Ramaphosa says the 114 South Africans who were repatriated from Wuhan, China, are testament to the efficacy of the lockdown in containing the spread of the coronavirus. The whole group tested negative after a 14-day quarantine period in Limpopo, having already spent 51 days under lockdown in China. Jenny Kalidis reports.
In his weekly newsletter, President Cyril Ramaphosa says the drastic action taken by the Chinese government ensured that the South Africans from Wuhan returned home uninfected. He says their experience demonstrates the effectiveness and the necessity of a national lockdown. The president says Wuhan, a city of 11 million people, had more than 50,000 infections. And now, after more than 2 months with stringent lockdown measures, the city had fewer than 20 new cases in the past 2 weeks. While he concedes that restrictions on daily life, movement and ordinary human contact are extremely hard to endure, he says these measures are necessary to save lives. Ramaphosa says if we remain disciplined and respect the lockdown, we will overcome the disease. Gia Nicolaides, Eyewitness News.
There are now at least 1,280 cases of the coronavirus in South Africa, with 2 confirmed deaths. With the COVID-19 virus now confirmed in the South African township of Khayelitsha in Cape Town, residents in similar settlements have already rejected any possibility of beating the virus. In Zandspruit, an informal settlement west of Johannesburg, residents say everyday life already comes down to survival of the fittest, yet in the face of COVID-19, no one amongst them can win. Teto Matlakwana has more.
Philemon Mufate has lived in Zandspruit since 2003. In that time, he's joined hundreds of residents along Beyersnodere Road as they burnt tires, protesting against their appalling living conditions. It's exactly this experience that has taught him that no one is coming to save them, forcing him to contend with the inevitability of death should a single case of COVID-19 be confirmed in the settlement.
All these things that we are doing, the protest, the blocking of the roads, the burning, whatever, it's for nothing. It's falling on deaf ears.
Residents of Zandspruit cannot adhere to the 21-day lockdown, which requires people to stay in their homes because the small shacks they call home are unlivable. Teto Matlakwana, Eyewitness News.
Social grant payments for the elderly and disabled are expected to be paid out from today. The South African Social Security Agency says it will be paying out 2 days early in an effort to lower the risk of infections. At least 17 million beneficiaries across the country are expected to travel and queue for their payments. Veronica Machwadi has more.
Government says it has taken the necessary measures to reduce congestion and ensure there is social distancing at pay points. Speaking at the Gauteng Provincial Government Command Council yesterday, Acting MEC for Social Development, Banyaza Lusufi, confirmed more than 700,000 elderly and disabled residents in the province will receive social grants over the next 2 days. He's encouraged grant recipients to swipe their cards rather than withdrawing cash. The MEC added that additional steps will be taken by the South African Post Office.
They will make available 5,000 liters of hand sanitizers for the elderly and the beneficiary. The office staff that is going to be used ordered 30,000 pairs of hand gloves so that all the office staff they can be in a position to execute this mandate in a safe environment, including 300 masks.
Meanwhile, taxis and buses will be allowed to operate throughout the week, adhering to the new laws, with citizens advised to carry both their ID and SASSA cards when traveling to collection points. Veronica Machwadi, Eyewitness News.
Finance Minister Tito Mboweni says he's been instructed by President Ramaphosa to prioritize structural reforms in response to the latest downgrade by ratings agency Moody's. On Friday, Moody's became the last of the 3 major credit ratings agencies to downgrade South Africa's sovereign credit rating to junk status. It warned the coronavirus outbreak will exacerbate the country's economic and fiscal problems. Khomotso Modise takes a look.
Moody's has cited South Africa's deterioration of fiscal strength and structurally weak growth as the main driver behind its decision to drop the country's rating to sub-investment grade. Finance Minister Tito Mboweni says when he informed the president about this decision, he instructed him to face this head-on. Economist Ndumiso Hatebe says South Africa's policy response during this crisis is critical.
The U.S. has just recently signed a bill for $2 trillion worth of stimulus. We've seen other stimuli in Asia, such as China, and in Europe as well. Really depending on the kind of fiscal and monetary responses that we solicit in our case, we could possibly leverage this as an opportunity to not waste a good crisis.
Meanwhile, Mboweni says he'll create a unit comprising 3 or 4 people within Treasury called Vulindlela. They'll be tasked with formulating and implementing the structural reforms. Khomotso Modise, Eyewitness News.
Over the weekend, the number of cases around the world jumped to more than 722,000. Of these, almost 34,000 people have died, with just over 150,000 recovering. Shamla Fisher takes a look.
Countries worldwide continue to implement measures to try to curb the rapid spread of COVID-19, but the infections and death tolls keep climbing. In Japan, at least 86 people have tested positive for the novel coronavirus at a facility for disabled people in Tokyo. A cook at the facility tested positive for the virus. Argentina and Guatemala have extended their stay-at-home rules for a further 13 days. Argentina has at least 820 infections. Over in Guatemala, at least 34 people are currently infected. The number of infections in the U.S. has risen rapidly in the past week, surpassing both China and Italy. More than 2,500 people in the U.S. have died, and there are more than 139,000 confirmed cases there. The Philippines recorded 343 new coronavirus infections yesterday, making it the largest single-day increase in cases since the outbreak began. Shamila Fisher, Eyewitness News.
Gold's at $1,615.80 an ounce. The rand's at 17.88 to the dollar, 22.20 to the pound, 19.82 to the euro. Brent crude oil's at $23.61 a barrel.
Traffic lights still out of order in Botskrain at President Fouché and Rabi. Athol Oaklands in the M1 is out as well, and Kingswan University Road out in Auckland Park.
In your sport, Minister of Sport Nathi Mthethwa offers some compensation for athletes and coaches suffering from loss of income as a result of COVID-19, and a call from the England captain Harry Kane to have the Premier League season cancelled if it's not completed by June the 30th.
A cloudy day in store for Gauteng. The temperatures will peak at highs of 25 and 26 degrees. The top story in Eyewitness News this hour: President Cyril Ramaphosa has used his weekly newsletter to stress the importance of a national lockdown at a time when COVID-19 is devastating the world.
Eyewitness News. In touch, in tune, and independent. For the latest, visit ewn.mobi.
A strong immune system is a vital prevention measure against viruses. Getting the flu vaccine is one of the most effective ways to boost your immunity and protect your family against infection. The 2020 flu vaccine is now available at over 400 Clicks pharmacies nationwide. For more info, visit clicks.co.za/fight the flu or speak to your Clicks pharmacist. Clicks, feel good, pay less.
What you need to know about the coronavirus
on the 702 app,
on 702.co.za,
and on 702.
702 Breakfast with Bongani Bingwa. Live.
Online.
Smartphones.
DSTV.
And 92.7.
And 106 FM.
It's 11 after 8. Sure. How about that, eh? Yeah. So, Zandspruit residents, an informal settlement west of Johannesburg, they are saying, forget about it. They're saying, how are we going to beat this thing? You know, and it's something to be concerned about. It's something to be worried about. I mean, we have to be positive, right? We have to do what we can. So, I'm not sure if we can give up and throw our hands in the air. But at the same time, I understand the challenges they are facing in many communities around the country, right? We've already seen, of course, this thing has hit Khayelitsha. So what does it mean for communities where people are congested? Listen, if nothing else, perhaps this. COVID-19 will show us that our destiny, our fate is linked. Your wealth and stature cannot save you. We have to be concerned about everyone, because if people in Zandspruit cannot self-isolate, we're all at risk. Right now, more than ever, we have to care about the poor. Give me your thoughts. 011-883-0702. Let's talk about ventilators next. Do we have all the equipment we need in our hospitals and our healthcare facilities to fight this thing, to beat this thing when the onslaught will come? And I'm keen to know from you, what app are you using to be able to conduct your normal work life, to be able to have meetings, conference calls, that sort of thing? I am finding Zoom is about the best one out there. You can record stuff, you can save stuff on it. I'm finding it working a little bit better than Skype, which of course has been around for years and years and years and years. What do you recommend? Let's share some practices, some experiences. The latest on the coronavirus around the world. 723,000 cases. We're approaching now almost 34,000 deaths. And importantly, to always remember, 151,000 people have recovered.
Bongani Bingwa on 702.
On 702.
Call him on 011 883 0702.
Let's quickly chat to Nduna. You're in Finetown. You're saying people are not adhering to the lockdown rules.
Yes, good morning, Bongani.
Good morning, Nduna. Talk to me. Where are you? What are you seeing?
I'm in Finetown. It's bad, Bongani. People are not listening.
What's happening?
You find people like, yesterday I found people, maybe 6 guys, sharing a quart of Black Label. People are just sitting on the streets. We haven't seen soldiers, we haven't seen police, nothing.
Yeah, it's tricky. It's a tricky one, Duna. I mean, obviously, your first response to a call like that is to be seriously irate because of the risk such behavior poses to all of us. But at the same time, is that something that's easy for me to do because I'm sitting in an air-conditioned studio in Sandton? I don't face the reality so many poor folks face across the country. One of the reasons our abuse of alcohol is so renowned is because people live with a sense of hopelessness. People don't have many options. If you're living in the way that we've been talking about this morning, what would you do? What would you do? What would adhering to these regulations mean? We're hearing people in Zandspruit say, listen, for them, it's always been survival of the fittest in any case. This virus isn't going to change their state and how they think about life and their lives. Do you get it? Now more than ever, we need to care about what's happening in Zandspruit and Khayelitsha, because this disease has brought that home in a way that perhaps nothing else has so far.
Stay up to date with all the latest information on containing and avoiding the spread of the coronavirus.
Only on 702.
It's a 8:15. We're joined now by Dr. Chris Archer, who is the CEO of the South Africa Private Practitioners Forum. Dr. Archer, very good morning to you. Thank you for your time.
Good morning, Bangani.
We're talking to you. You were quoted in the Sunday Times yesterday, and I think they brought an issue that we need to, I suppose, talk about quite often in the coming weeks. The issue of whether or not our healthcare system, broadly speaking, is geared for what one assumes is going to be an onslaught against it because of COVID-19. What's your sense?
Yeah, no, look, I think we are totally unprepared. I mean, not that South Africa is any different to probably the entire world at the moment. Everybody is scrambling to find the necessary.
I'm Stuart McIntosh with the BBC News. Hello. President Trump has said that deaths from COVID-19 could peak in the United States by mid-April, the time when he'd said he'd planned to reopen the country. He now says he expects the country to be well on its way to recovery by the beginning of June. Here's John Sopel.
First, the president said there'd be social distancing for 15 days. That was to have expired today. Then he said he wanted to set Easter weekend as the date for the reopening of America, when he said he wanted to see packed churches, a pronouncement that caused deep alarm among his public health professionals. But last night at a White House news conference, in the face of evidence that the coronavirus outbreak is getting worse, not better, he extended social distancing restrictions until the end of April. President Trump said that government modelling now showed that the peak death rate was likely to come in 2 weeks' time.
The charity Oxfam says aid worth $160 billion is needed to prevent millions of coronavirus deaths in the world's poorest countries. Ariane Schippers reports.
The impact of the virus on countries with weak public health systems, poverty, lack of access to clean water and sanitation could be catastrophic. The charity is especially worried about the spread of the virus in overcrowded refugee camps and large slums. The funds of a global response should be spent on prevention, millions more health workers and free testing and treatment. The $160 billion sum needed, Oxfam points out, would be less than 10% of the fiscal stimulus in the US to deal with the economic impact of the pandemic.
Scientific data has shown a marked decrease in air pollution in urban areas of Europe, where there's a lockdown to curb COVID-19. Satellite images show lower than average levels of nitrogen dioxide in major cities. Here's Sanjay Dasgupta.
Images released by the European Space Agency show Brussels, Paris, Madrid, Milan and Frankfurt all recorded a reduction in average levels of nitrogen dioxide between the 5th and the 25th of March compared with the same period last year. This coincides roughly with lockdowns in many European countries where road transport, the largest source of nitrogen oxides, has been severely curbed and output slowed at gas-emitting factories. Findings by the agency reveal air pollution causes around 400,000 premature deaths in Europe every year.
Peru's economy minister has announced an economic stimulus package equal to 12% of the country's entire domestic output. Maria Antonieta Alva said about $26 billion will be injected in 6 tranches to counter the effect of coronavirus. Peru's important mining and tourism sectors will be a particular focus of the package. This is the World News from the BBC. President Xi Jinping has exhorted Chinese firms to resume activity as the coronavirus pandemic continues to diminish in the country where it started. State television showed Mr. Xi visiting a factory on Sunday, saying the government would adjust support policies for small and medium-sized businesses. The number of confirmed cases of COVID-19 continue to increase in some of the small island nations and territories of the Pacific, despite their comparative isolation. French Polynesia has recorded 35 known infections, while cases are rising in the US territory of Guam. A week-long lockdown has begun in Tonga. Samoa has been boosted by a grant of $5 million from the World Bank. A cruise ship stricken with the coronavirus is transiting eastwards along the Panama Canal in the hope of finding a port that will allow its remaining passengers to disembark. The SANDF has recorded 4 deaths from the virus. The mayor of the US city of Fort Lauderdale, SANDF's intended destination, has said he won't risk the health of his citizens. A rapid response unit created by the British government to tackle the spread of fake news about the coronavirus is reported to be dealing with as many as 10 incidents a day. Rory Kethlen-Jones has the details.
Last week, hours after the government started sending texts urging people to stay at home, several fake versions of the message began circulating, one of them telling people they'd been fined for breaking the rules. Misleading advice claiming to be from Stanford Hospital appeared on social media, urging people to gargle water to cure the virus. And doctored screenshots of the gov.uk website have been used in a scam promising tax refunds. A rapid response unit within the Cabinet Office is working with social media firms to remove harmful content and rebut false information.
BBC News. I'm Stuart McIntosh.